Hello, my name is Dr. Ruven Jacks. I am a medical doctor and a trauma surgeon. I deal with major bleeding as a part of my daily life, and my job is to basically find patients that have been in severe traumas, some major accidents or anything that has caused significant trauma or bleeding, and I need to stop that bleeding in time and get them to survive. Now, some of the patients that have major bleeding, I actually never get to see them. And the reason I never get to see them is that they bleed out or they die before they even get to hospital. And that is something that is unnecessary. Bleeding like that can be stopped. There's another subgroup of patients that do bleed prior to coming to hospital, but bleed too much. And by the time I receive those patients, their bodies are so weak, although I can stop their bleeding in hospital and get them to surgery and do what I need to do surgically to stop the bleeding, they still die a few days later from what we call organ failure. And that's because of the initial bleed. And as much as we can stop the bleed and replace blood as a blood transfusion, we can never quite get them to the same state as they were before they bled out. So the key to stopping bleeding is exactly that, is to stop bleeding as absolutely soon as possible. Even by the time Matsolo gets there, if you lose more than a cup of blood, you're already in one of these phases where you're at risk for organ failure. And the sooner bleeding can get stopped, the better it is. And you, the public, have the power to save the life, a power that even myself as a trauma surgeon doesn't have, because I'm not there at the time of the initial massive bleed.